helping them as much as you can. And this doesn't mean you quitting your job and starting a full-time care for your relative. It just means that on that Saturday when you don't go to work, you rush down and see how they are doing and try to check carefully and see that the people caring for them are actually doing all the things they are supposed to do. Keeping the skin surface dry is something that if we joke with it, it leads to pressure sore. If somebody is supposed to be changed every 2 to 3 hours and the person is being changed once a day, then that becomes a problem. And I know during risk assessment, the tissue viability nurses, the carers, and the physiotherapists, as well as the occupational therapists, would have written a report and some recommendation as to how those things are to be carried out, how frequently the person is required to be assessed, changed, and how often they should be they should be repositioned. So ensuring that those recommendations are followed, I feel, is the starting point. And of course, it is all laden and burdened on us as healthcare professionals to be able to provide the required care and observe. One thing I do when I go out for assessment for wheelchair, I ensure that I don't just complete assessment and go away. I observe other things, and if there is need for me to make appropriate referrals to other professionals who their input may be needed for that customer or patient, then I try to complete that to ensure that they get all the care that they need. So yeah, as healthcare professionals, we are also responsible in preventing pressure sore, and of course we are also burdened with the responsibility to educate the relatives and the patient on the best way of caring for themselves, because of course they may not know, and they may be ignorant of some of the things they are doing, and they think it's the best practice because their friends, their relative, or even their neighbor have told them that it worked for them. So it's good as we go out as healthcare professionals, we risk assess, and from the outcome of our risk assessment, we are able to advise. Just like you said, if the person is able to weight shift, then the person should be able to weight shift. If the person is supposed to be turned every 1 hour, every 2 hours, every 3 hours, depending on how severe their case have become, then we have to make those recommendations, and that is it, and up to the patient themselves. Unless they lack the mental capacity, they also have the responsibility to ensure that they don't develop pressure sore. And what are their responsibility? Doing skin check every morning, you check the surfaces, you ensure that you are not wet for a very long time if the person is having incontinence, and the person ensures that the person's skin is dry and the environment is well kept to avoid infection and all of that. So the responsibility is just all faceted. It's cut across everyone that is involved in the pipeline of care, I would say.
Yeah, that's a really great answer. And I think you're right. It starts with the person themselves, and feeds outwards to family, even friends, relatives, professionals. We all have that responsibility to actually ensure that person's getting the best care possible. One quick question that I want to put to you: what's the most dangerous myth professionals still believe about pressure injuries?
One of the dangerous myths is just the redness of the skin. Is just a stage 1. It's not really serious, because then in that situation, such person that believe that because it's just stage 1, it's not serious, may not actually take preemptive approaches to actually prevent it, right? And of course, some people would also say, because the person have some level of function, they cannot develop pressure sore. And that is also a very dangerous one, because if you believe that, then that person that have some level of function is neglected, and then the person may end up actually developing pressure sore, because the pressure sore is not considerate of age, is not considerate of race or whatsoever, or even level of function, provided there is a considerable amount of pressure to that little surface area. For those using the wheelchair, they can actually develop pressure sore over a long period of time. It may just take more time. You have anything to share around that as well?
I would agree with you there. It's not such a big problem. I think people think,
Yeah,
because they see it in isolation.
yeah, yeah,
The community nurses may only see one or two people on their round each month who's got
yeah,
a sore. But when you see it in isolation, it doesn't seem as bad. But when you look at the overall picture nationwide,
yeah.
you can really tell how much the system's been failed. Now, I've got a couple of. I wanted to bring up some essentials for people to sort of remember
Okay.
as we sort of come towards the end of the show. Have you got anything else that you want to add, though?
I think I would like us to really talk about the skin bundle. Remember the skin bundle? That is the SSKIN
Yeah.
bundle, the skin bundle, which is basically like a framework that is used to ensure that pressure sore is prevented and managed. So basically, as I said, skin, SSKIN skin bundle. It's a standard widely used across the NHS. It's used in almost every trust I've seen. The tissue viability nurses, the occupational therapists, the what's it called, the carers and all of that, they use this. And the first S stand for surface. So we are looking at appropriate surface that the person is sitting on. We are looking at the type of cushion. We are looking at the type of mattress that the person is lying on. We are considering if those surfaces have been risk assessed and they are suitable for the level of risk this individual is at in terms of developing pressure sore. And we're also looking at the second S in that skin, which is skin itself. So, and this is speaking to skin assessment, trying to inspect the skin and see that there is no breakdown, the skin is dry, and ensuring that everything is just good and in perfect condition. And of course, flagging whatsoever abnormality. It could just be appearing like a blister. You are not supposed to say, oh, it may just be a blister, and then you pop it and forget about it. Rather, once anything is noticed, you expected the individual is expected to inform the professional so that they can further examine it and actually establish if it is a pressure sore or it is just an ordinary blister that can be can managed easily, or other care plans can be put in place. And of course, we have still in that skin, we have the cake, which is keep moving. And this keep moving does not speak to people actually standing up and walking. It speaks to the level of function they have. They should make use of it. If you can sit, then keep standing from your moving from lying down to sitting. And if you can stand up, of course, keep changing position to standing. If you can walk, keep walking. And if you cannot do any of these and the person has such limited level of function that they cannot even sit up on their bed, then these people have